GatewayC Bitesize, supporting earlier and faster cancer diagnosis, commissioned by the Greater Manchester Cancer Alliance.
Lower GI cancers. Think A to G. Our specialist is Dr. Roger Prudham, consultant gastroenterologist.
A is for any change in bowel habit, and indeed any age. The FIT test is so good, so simple to do, and you'll get the result back so quickly that even in a patient who's 20 or a patient who's 80, you can send a FIT kit off, and within a week you're going to have an idea of what their risk of having underlying bowel cancer is. I think in particular it's exciting to think of the impact this may have in early diagnosis of bowel cancer in younger people. B is bleeding. As we all know, bright red rectal bleeding can be a sign of presentation of anorectal cancer and colorectal cancer. It is perfectly reasonable to do a FIT test in patients who are bleeding. That is a key development over the last 12 months or so, and there is good evidence to support doing that. So don't be afraid to do a FIT test in patients who have bright red rectal bleeding. The other thing to bear in mind is overall, the brighter and more dramatic the bleeding, the less the likelihood is there'll be an underlying cancer. In patients under 45 who have symptoms of hemorrhoids such as perianal soreness, itching or a lump, who have rectal bleeding, the chances of them having anything other than hemorrhoids is less than 1 in 600. C is for check bloods, check a full blood count, liver function test. EGFR and renal function is also helpful in case we're needing to order staging CT scans or do a CT colonoscopy. The full blood count can be important. Elevated platelets can be an indicator there's underlying cancer, or of course a full blood count may demonstrate iron deficiency anemia, which might prompt an urgent referral for suspected colorectal cancer. So don't forget to do the bloods. In particular though, don't be falsely reassured by normal bloods. Colorectal cancer, even at advanced stage, can still present with normal full blood count, liver function tests, etc. D is don't forget family history. If you have a first degree relative diagnosed with colorectal cancer under the age of 50, or 2 second degree relatives diagnosed under the age of 55, that could be indicative that there may be a genetic predisposition to bowel cancer and could prompt a referral to a genetics counselling service, such as the one at St Mary's. It is an interesting time for familial forms of bowel cancer, and the bowel cancer screening programme is later this year going to be accepting Lynch families in for their colon cancer screening. So this is going to gain a higher profile as we seek to get more and more early diagnoses of cancer. E is for examination. It is vital that a rectal examination is undertaken before referring a patient on the colorectal cancer pathway. The determination that there is local rectal or anal pathology will be an indicator in itself for referral on a 2-week wait pathway without needing to wait for a FIT result. We can step patients down very simply if they're FIT negative, if we know there's no anorectal pathology, because we know in that situation it's very, very unlikely that there's going to be an underlying bowel cancer. F is for FIT. The first thing I'm going to say is always use the correct container, label it properly. It does need a small amount of stool to fill it. We commonly get them not done because they get overfilled. Think of doing a FIT test in anybody with colorectal symptoms, because if they're negative, we can confidently exclude bowel cancer as a cause of symptoms. Final thing to remember about FIT is that the cutoff in the NHS bowel cancer screening programme is different in respect of being positive or negative than those in patients with symptoms. In the screening programme, it's set high at 120 to deliver around about 2% positivity in the population that's screened. The symptomatic threshold is 10, which is much, much lower, because a patient coming to you with symptoms is asking a very different question than is being asked in the screening programme. They want assurance whether they've got bowel cancer or not, and the FIT test gives you that, and that's why the threshold is so much lower at 10, to give us a much more confident assurance that there isn't an underlying bowel cancer. G is the Greater Manchester Referral Proforma. Please keep that up to date. Use the most current copy of that, because that is the one that contains all of the intelligence that we've developed over the last couple of years to make the referral process as slick and as patient-focused as it can be.
Think A to G. A, any change in bowel habit. B, bleeding. C, check bloods. D, don't forget family history. E, examination. F. Fit. G. Greater Manchester Referral Proforma.
GatewayC Bitesize, supporting earlier and faster cancer diagnosis, commissioned by the Greater Manchester Cancer Alliance.